Hello, my name is Isidore Oliveras, and this is my mock interview. So, just a little about me right now. I currently work in healthcare, or I'm shadowing in healthcare, and I have an experience in supporting administrative and operational roles. I previously worked as a patient access representative at Mercy Hospital, and there I was just kind of assisting patients with registration, insurance verifications, and also just coordinating with healthcare teams to ensure smooth patient flow. I also do have several years of leadership experience as working with an operational director at Chick-fil-A. I've worked at 3 locations where I've supervised, trained staff, and helped improve operational efficiency. But right now, I'm just gaining additional healthcare experiences by shadowing and completing hours at Peewell Primary Care in Denton. That's kind of where I'm learning more about clinic operations and patient coordination. And in the long run, my goals is to continue growing in healthcare administration, and eventually move into leadership roles where I can improve processes that support both patients and healthcare staffs. So, just, what do I consider my personal strengths? I will say that one of my biggest strengths is leadership. At Chick-fil-A, I supervise teams and train new employees. I helped improve shift operations just to keep things running efficiently. I'll say another strength is organization and operational thinking. Working in patient access required you to have accurate records, verifying insurance, and coordinating with patient flow. Um, it really did require to detail and a strong time management. A third strength is communication. I work regularly to interact with patients, coworkers, and supervisors, so I've developed a strong interpersonal skills that help create a positive and professional environment. That is the long-term goal that I've had. So how do I handle multiple tasks and deadlines? I prioritize tasks based on urgency and impact, especially when patient care is involved. It's kind of the last place they want to be, so we want to make sure that it's up to standard. And so, for example, when I was working in patient access at Mercy Hospital, I often had to check in patients to verify insurance, answer phones, and communicate with clinical staff at the same time. And so the best way I did go about that was I stayed organized by focusing on the most urgent tasks first, and in order to maintain clear communication with my team and with the patients who are waiting. Um, if you were to contact my references, what would they say about me? I believe they would say that I'm dependable, hardworking, and proactive, more proactive than reactive. They would likely mention that I take initiative, support my team, and maintain a professional attitude even when busy or stressful situations. What qualifications allow you to succeed at work or school? I would say that I think the combination of the leadership, the steward leadership experience that I've had, and so far the healthcare exposure and the academic training in the medical health services management program has prepared me well for success. Balancing work, school, and my shadowing experience has helped me to develop strong discipline, time management, and the ability to learn quickly in professional settings. How do I work with others? Um, I would say the biggest thing is just focusing on clear communication and mutual respect. You always want to listen to others' ideas and support, my team when they need help. From my leader experience managing teams and coordinating with healthcare staff, I've learned that teamwork is essential for maintaining efficiency and providing good service, even if you are independent. It's always just making sure that you are setting the standard, the tone, and just always giving the reason of the why behind everything. How do I approach stressful situations? I would say that I try to stay calm and focus on solving the problem earlier. Um, Solving the problem rather than reacting emotionally. And service environments can be fast-paced, as I've learned so far in my shadowing hours. So staying composed helps ensure that tasks are completed accurately, and patients still receive quality service. That's the most important thing. Describe a time when you had to make an ethical decision. So I would say in the healthcare settings, protecting patients' privacy is critical. Um, there are many times, but there were times when individuals asked for information about patients that were not authorized to receive, such as like a HIPAA authorization. In those situations, you have to, I followed policy and protected patients' confidentiality, even if it meant explaining the rules to someone who was frustrated. Describe one policy you would implement to prevent disease spread. I would say one policy I would emphasize is strengthening infection control practices such as proper hand hygiene, disinfecting shared services, and just encouraging, other staff members or employees to stay home when sick. Consistent training and reminders can help ensure that these practices become part of a daily culture within an organization. How would you handle an upset employee when you made a mistake? First, I would acknowledge the mistake and take responsibility for it. Then I would listen to their concerns and work together just to correct the issue. I believe transparency and accountability are important for maintaining trust within a team. I've learned that heavily, especially in my time of leadership at Chick-fil-A, just to always make sure that they feel heard and that we can give them the reassurance that we'll take care of it going forward. What would you do if you saw a colleague acting unethically? If I observe, just like an unethical behavior, I would first make sure I understood the situation correctly, get all the details. But if it clearly, violated policies or ethical standards, I would follow the organization's reporting procedures and notify a supervisor or appropriate authority. How do you prioritize tasks at work and in life? I would say I prioritize based on urgency, deadlines, and just kind of the overall impact. Tasks related to patient care, team operations, or major deadlines always comes first. I always try to plan ahead so I can manage both work and school responsibilities, effectively. How do you handle change in healthcare environments? So I would say, healthcare it's always constantly evolving with new technology, regulations, and procedures. I try to stay open-minded and view change as an opportunity to improve efficiency and patients' outcomes. I'm focused on improving efficiency, and the patient care is a priority of mine. Where do you see yourself in 5 to 10 years? In 5 years, I would see myself continuing to grow in the healthcare administration and gaining more leadership responsibilities within a clinic or healthcare organization that I am in. In 10 years, I'd hope to be in management or executive role where I can help improve healthcare operations and just contribute more into better patient experience. And I would say that the most important reasons of the three reasons why um, we should hire me is y'all should hire me is because, well, first I bring both leadership experience and I have exposure to healthcare so far. Second, I have a strong work ethic and I'm committed to learning and improving professionally. The third thing is I understand the importance of teamwork and operational efficiency in healthcare environments. And so I bring a lot of proactiveness and a lot of teachable moments for myself and for others as well. And this right here is just a slide of what kind of questions I would ask the interviewer. What does success look like in this role? What are the biggest challenges in this position? And how does the organization support growth? And then how does this role impact patient care? Why is it important? Why it is important to be in this position? And so, thank you so much for watching this video.